What is Ambu Bag? Ambu Bag bag valve mask device. Manual device to help patients breathe when they can't breathe on their own. Used worldwide in ambulances, ICUs, emergency rooms. Parts of Ambu Bag. Bag, you squeeze it to push air. Valve controls airflow, prevents backflow. Mask seals mouth, nose. Oxygen tube connects to oxygen source. Oxygen reservoir gives high oxygen concentration. When to use Ambu Bag? Cardiac arrest, respiratory arrest, trauma, drug overdose, newborn resuscitation, during anesthesia induction, patient transport. Why it is life-saving? Prevents brain damage due to lack of oxygen. Supports breathing until machine ventilation starts. How to use Ambu Bag? Check the bag is working. Connect oxygen 10-15 liters min. Place mask tightly on mouth, nose. Tilt head back or jaw thrust if trauma. Seal mask using C technique. Squeeze bag slowly, watch chest rise. Repeat breaths depending on age. Patient breaths per min. Adult 10-12. Child 12-20. Infant 20-30. Precautions. Avoid over squeezing. Stomach bloating. Avoid fast ventilation, barotrauma. Ensure tight seal. Monitor chest rise. 2-person technique. 1 person holds mask with both hands. 2nd person squeezes bag. Safer and more effective. Common mistakes. Loose mask seal. Too fast ventilation. Head not properly positioned. Not watching chest rise.